Hi everyone, I'm Michelle Coons. I'm a physical therapist. In today's video, we're going to be talking about tennis elbow rehab, also known as lateral elbow tendinopathy. This is going to be part of our elbow series. Now, let's talk a little bit about the name. So way back then, we used to call it lateral epicondylitis, but since then, we've kind of realized that inflammation is not the primary driver of this condition. And then the name got changed to lateral epicondylalgia, which just means painful lateral elbow. So that's not really helpful either. Nowadays, we call it lateral elbow tendinopathy because we recognize that it's a persistent pain and loss of function that's related to mechanical loading of our lateral elbow tendons. So let's talk about the muscles that attach to our lateral epicondyle. So our lateral epicondyle is, if my palm is facing the other way behind me, then it's going to be the bump that's on my elbow on this side, not the one that's on the inner side. Here it would be the pinky side, but the one that's on the thumb side. So these muscles are responsible for the motions of wrist extension, finger extension, and forearm supination. And they've found that the muscle extensor carpi radialis brevis is most often involved. Symptom reproduction usually occurs during gripping activities. So that might be gripping a leash while you're walking your dog, gripping some heavy grocery bags, might be during weightlifting or lifting dumbbells. It can also be during resisted wrist or finger extension. Let's talk a little bit about the differential diagnosis. There are other conditions in the elbow region that can also be painful, such as radial tunnel syndrome. And so it is important to get an assessment done by an appropriate healthcare provider, just so you know that what you're dealing with actually is tennis elbow. Causes of tennis elbow are usually due to a mismatch between the capacity of those tendons and the load or the demand that you're putting on them. So again, this could be a recent increase in how much weight you're lifting. If you got a new dog and now you're walking the dog and they're pulling on the leash, so you have to really stabilize your wrist in order to control them. The goal of rehab is to work on that capacity so that it's going to be equal or more than what we ask our body to do. So the ability to tolerate and recover after exercise or whatever activity we want to do is going to be possible. Studies recommend eccentric exercise, heavy, slow resistance. They say that these are pretty effective, but also depending on the person, exercise in general can be effective as well. Different treatments tend to work for different people. It's important to temporarily modify your activity. So if lifting weights is the aggravating activity, then temporarily scale down how much weight you're lifting or how many reps you're doing or how many sets you're doing. Maybe give yourself some more rest time or rest days. And then during that time, you're going to be building up the capacity of those tendons and muscles and then gradually reintroducing the desired activity. Temporary short-term relief, we can look to orthotics such as an elbow sleeve or a counterforce strap. Again, these are passive treatments. So instead of keeping them as the primary treatment, we're going to keep them as adjuncts in addition to our progressive loading exercise program. The first exercise is going to be a wrist extension strengthening. So this is a demo of wrist extension strengthening. I'm using just a water bottle, but if you have a light dumbbell, then you can also use that as well. Basically, I'm going to be putting my forearm, stabilizing it on a surface, and then having my wrist free to move if I'm doing an isotonic exercise. But if I am really flared up and I'm having some pain, I can also do an isometric exercise, basically holding the position. So I'm contracting the muscles, but there's no visible movement of the joint. So if I'm doing an isometric contraction, I can hold it for 30 to 45 seconds and do it about 4 to 5 times. If I'm doing an isotonic exercise, then I can actually move through the range of motion. So I can let my wrist slowly drop into flexion and then move it into extension. Now, you can determine if you can do partial range of motion or full range of motion depending on your symptoms and what's tolerated. But if you're moving through a range of motion and doing an isotonic exercise, you can try for maybe 8 to 10 times. Try it maybe 2 or 3 times a day, at least 3 times a week, and just monitor from there. If you're finding the next day it's more flared up than usual, then perhaps you need to go with a lighter weight or maybe less reps or less sets, things like that. Now, if you're doing the heavy, slow resistance protocol for tendinopathy, then you want to be able to carry a weight that is heavy enough that you can do about 5 to 6 reps before you get too tired to do any more. And you're going to also work on your tempo. So if I'm holding, let's say, a heavier weight where I can only do about 5 or 6 reps before fatigue, then I'm going to go up 1, 2, 3, 1, 2, 3 on the way down. So I'm using a little bit of tempo to mix it up as well. Again, you can do that max about 5 to 6 times depending on the weight that you choose. And you can try it maybe 2 to 3 times a day, at least 3 times a week. The second exercise is going to be supination strengthening. This is a demo of supination strengthening. So here I have a hammer, but you can also use a dumbbell or like a water bottle is fine as well. Depending on where I hold on the hammer, then it's going to make this exercise easier or harder. So the closer I hold to the bottom, this is going to be harder. If I hold closer to the middle or the top, it's going to be easier. Okay. So from here, for supination strengthening, we're going to actually do the motion of pronation, which is turning my palm down. But because I'm controlling how fast I let this hammer fall, I'm actually using my supinator muscle to do that. Okay, and then I'm just going to bring it back to the vertical position. And then I'm going to control how fast I let that come down using my supinator muscle. Again, I am stabilizing my forearm on a surface. My elbow is slightly bent. So try that about 8 to 10 times, 2 to 3 times a day, at least 3 times a week. You can modify it based on your symptoms and your tolerance, whether you need to go lighter or start with an isometric. You could always start partially in this pronated position and then have that supinator muscle contract and hold it there without letting the hammer fall further. The third exercise is going to be grip strengthening. All right, the last exercise we're going to show on this video is just working on our grip strength. Anytime we're doing any sort of gripping activity, we need to stabilize our wrist. So grip strengthening is also going to affect our wrist stability. Okay, so anytime we're holding a leash, holding a heavy grocery bag, we're stabilizing our wrist so it's not flopping around. Okay, so here I have just a little squeezable ball, but if you have like a stress ball or anything else like that, that will also work. There are different ways that we can do this. Again, we can hold a squeeze, for let's say 30 to 45 seconds and then relax, or we can do consecutive squeezes, maybe 10 to 15 times. And try for 2 to 3 sets a day, at least 3 times a week. Okay, we can also work on our grip strength with our hand in different positions. So here you see we can also use a weight plate and hold it like that. And then I'm rotating my forearm back and forth, basically into pronation and supination, while keeping my shoulder and the rest of my body stable and just making sure I'm not letting that weight fall. The same with the kettlebell here. You can also hold it either from the handle, or even some people will hold it from the bottom of the kettlebell and turn their forearm back and forth slowly with good control without dropping the kettlebell. There are a lot of other considerations when we want to consider long-term success of rehab. So we want to talk about proximal strengthening. So proximal, again, means closer to the torso or the trunk, Distal means further away from the trunk. So if we're working on things like grip strength and our forearm or wrist strength, we also don't want to neglect shoulder and shoulder blade stability. So that's going to be important. Working on the periscapular muscles as well as the rotator cuff muscles. We also want to consider, do we have enough mobility of the joints above and below the elbow as well as the elbow itself? Is our wrist motion or range of motion restricted? Is our elbow range of motion restricted? Is our shoulder range of motion restricted? Those things are going to affect the elbow region. We also want to consider other aspects of life, including our stress levels, our sleep hygiene or sleep quality, as well as our diet. These are things that can also affect our pain perception. It has been found that most people, they do improve significantly or even completely by 1 year without any treatment. However, if you don't do any rehab to increase the capacity of these muscles and tendons, you're going to be more likely to have this condition recur again. So if you do the rehab and you keep that up, it's going to be less likely that you'll have this happen again. All right, I hope you found this video helpful. If you did, like and subscribe. All right, see you next time.